good afternoon, and welcome to the 117th session of the Flint Community Webinar on Coronavirus. We're so excited that you joined us today for this very important event. This session is sponsored by the Flint Center for Health Equity Solutions, the Healthy Flint Research Coordinating Center, and the Michigan Prevention Research Center. Our goal has been for these 117 weeks to bring a local context to a global pandemic. And unfortunately, we must remind us that we are in a global pandemic. I'm thankful to be your moderator today, Yvonne Lewis, wearing several hats here today, the founder of National Center for African American Health Consciousness, co-director of the Healthy Flint Research Coordinating Center, and an advocate for Flint community. We are excited that we have so many partners that have joined us for these 117 weeks because we could not do this alone. The Healthy Flint Research Coordinating Center and Community Academic Partnership stood up to bring some context and insight to what was going on during the water crisis, and it has expanded because as we were planning for our annual symposium, this pandemic emerged. And so for this 117 weeks, the partners that you see here, and for those of you that have joined us by phone, I'll just give you a couple of these partners because they're on the line today, even to answer questions that you might have. We have representatives from the Genesee Health Plan, from the from the Genesee Health Plan, from Wayne State University. We have representatives from the Genesee Health System, and so many other, Michigan State University and the University of Michigan, and the list goes on of partners who are here to help you. Hurley Medical Center, Michigan United, and I could go on. As you can see here, these number of partners that want to make sure that we bring you clearly information that helps us make decisions about what's happening here locally, even the City of Flint and the Genesee County Health Department. Yes, as I said, we're still in a global pandemic. And as we are looking at this, things are still happening. We want to acknowledge that next week, Juneteenth, this is Juneteenth, June 19th. And it's a series of days. And I would ask Dr. Reynolds, I'm sure he has some good history on this. Juneteenth, as one of our historians, Dr. Reynolds, this was considered Emancipation Day. It wasn't just one day, but it was a series of days that led to the African Americans, and we would call Blacks in those days, Negroes, who understood that the Emancipation Proclamation had been signed. Dr. Reynolds, I know you got a tip for us there.
Well, the tip is this: the Emancipation Proclamation was signed years before Juneteenth. However, the folks in Texas didn't get the word, and the slave owners definitely did not get the word to those they had enslaved. So when the Union got to Texas, it was announced in Houston, and that is how we got Juneteenth. It also begs the question that Frederick Douglass would raise: what is the 4th of July to me? Well, Juneteenth means more historically for both African Americans and any American, because it was when we finally got to the point where the hold of slavery was broken.
Thank you, Dr. Reynolds. And that leads us to the opportunity that so many people have today that we didn't have then, and that's the opportunity for education. And so we also want to congratulate the 2022 scholars who have graduated from high school, even in the midst of the pandemic. 3 years, some of them have never, in 2 years, some of them weren't even in classrooms, but they persevered and have graduated. So that means whether they're there were some little elementary school graduations, there were middle school graduations, there were high school graduations, and even college graduations. So our hats off to the college graduates. We have an amazing session for you today, and so I hope that you'll all stay here with us. We have a special guest, Dr. Paul Kilgore, who is the Director of Research and Associate Professor at Wayne State University. We'll hear from him. We're going to have a little bit of a conversation with our roundtable team today, and of course, some very important updates for you that you don't want to miss. So even if you're joining us by phone, you're joining us in the webinar, or even by Facebook, you still have an opportunity to have some of your friends and colleagues join us for this conversation today. We're going to start off with a conversation with Dr. Paul Kilgore. Dr. Kilgore has been with us before, And today we're going to focus in on a number of issues. Oh, I missed something. Let me back up just a quick minute. I want to just say to those of you that are in the webinar, you have been putting questions in, and we've been trying to capture those questions. Today, I just want to take a quick minute before Dr. Kilgore comes to show you some of the questions that have come forward and ask you to continue to put questions in. And we're doing our best to try to make sure that we get some responses for you for these questions. Sometimes we don't have the answers, but one of the things we've committed to is that we'll try to get an answer and make sure that it's credible. And so one of the questions that came up was about being certain that those who are testing positive at home are reporting those cases. And we did have some insights from the health department on that, and we'll keep following that. There was a question about why do we stop some vaccinations like smallpox instead of continuing to ensure eradication? Another question, is there a plan for a third booster from Pfizer or Moderna? Some of that information is coming forward today. And is the current endemic flu a variant of the flu from the 1918 pandemic? So this means that some of you are asking great questions and you're putting us to work, because we have to do some investigation or research in order to find those answers so we can answer them credibly. So now we're going to go to Dr. Kilgore. Dr. Kilgore, you were here with us before, and you provided some tremendous information. You had lots of slides for us, but today we're just going to have a conversation. And I want to start off, Dr. Kilgore. You have been very, very involved from the early stages of the pandemic, looking at the variants, the virus itself, looking at some treatment plans. So I'm just going to give you a few minutes to kind of set the stage for us, and then we're going to ask a few more questions. Welcome, Dr. Kilgore.
Perfect. Thank you very much, Yvonne. It's great to be here. Hi, everyone. And you know, you're absolutely right. Since the beginning of the pandemic, I know everyone's been tracking the things very carefully. We've seen a lot of changes. And I think one of the things I wanted to do right now, Yvonne, is just kind of update people on where we stand with the pandemic and kind of talk a little bit about what we're facing right now. So if you look at trends across the country, and this means within Michigan, but also many other states, we're actually seeing an uptick in cases, test positivity, hospitalizations, and deaths. The CDC has some data already projected into July, so I'd like to mention some of that modeling data in just a second. But one of the things I do want to emphasize also is that right now, we have new variants, and you could also call them sub-variants of Omicron, the Omicron virus, that are now circulating not only in Michigan, but other parts of the country. And so what we know is that each week, CDC and many laboratories around the country are analyzing strains of the SARS coronavirus to take a look at what are the current circulating strains. So one of the things I wanted to mention for folks today is that we are seeing 4 major strains right now in Michigan and around the country. The first one I want to mention is the most common one. And it sounds like a mouthful, but the way you can just say it, I think easily, is BA.2.121. This strain is abbreviated, if you see it in print, BA.2.12.1. That strain is now accounting for about 62% of infections. The second most common one that we're seeing right now is the BA.2 or BA.2 subvariant. This is accounting for about 25%, or 1 out of every 4 infections that are identified. And then we have 2 newcomers. These subvariants have originated from South Africa in the beginning part of the year. They're now in the United States. We found them here locally. The other thing to know is that they are on the rise. And so keep an eye out for these and ear out for these in the news as well. Those are the BA.5 or BA.5. It's about 7.6% of strains that are detected and analyzed. And then the BA.4. The BA.4 accounts for about 5.4% of the infections that we're seeing in the United States. Now, as far as these variants go, one of the things I did want to mention is that they are steadily increasing. And really what you want to think of with this virus is that it is adapting to us. It's adapting to our immune systems. It's adapting to the human populations around the world. And one of the things that the virus is very good at doing is adapting so that it's less deadly. So it's not killing as many people, but it's better and more efficient at transmitting from one person to another. So if you're the virus, you want to make sure you survive, but you don't want to kill off the host because that means that you may die off too. So the virus has been very good now at adapting to us. It now is causing infection, which does not appear to be more severe in its clinical presentation or disease course than the original strain that we saw back in 2020 or even the Delta in 2021. What we are seeing, though, is persistent transmission in populations. And one of the reasons for this is very simple. There's a large percentage of people who still have not been vaccinated. So those people I worry about the most. They're most vulnerable. They haven't had 1 or 2 doses, which we call the primary series. They have no protection. They may have been infected in the past with the natural infection, which will give some level of antibody, but that antibody will wane over time and may not be as durable or long lasting as some people that are vaccinated with 2 doses. The other thing I want to point out with the vaccine series is that if you have gotten 1 or 2 doses of the vaccine, one of the things that's still very, very important is to make sure that you get a booster dose of the vaccine. So a much smaller proportion of people in Michigan have already received the booster or received the booster. And that's the thing I worry about now, because when we see this uptick of cases due to these new variants, having a level of protection, meaning a level of neutralizing antibody, that IgG antibody, is extremely important. You will get that initially with the first 2 doses, but the booster dose is super important because it helps stimulate the antibody production. It helps you get a level of antibody that even if it goes down a little bit over time, it's still going to be there to protect you against a new strain that you may be faced with. And one of the things that,
Dr. Kilgore, just right there, because this is a question that's come up all the time. Now, you just mentioned like 3 or 4 new variants that are coming out that are not coming. They are present in our community today, but we don't have a new vaccine. So you're saying the booster of the current vaccine? Because one of the things that we're wondering, if you compare to flu, there were updates in the vaccination. So can you talk a little bit about that so that we are clear on it?
Absolutely. So one key word that I want to mention to people today is the word cross protection. And cross protection is this idea that if you get vaccinated against one particular strain of a virus and you create antibodies to that original strain, the antibodies that you make and have circulating in your body will have some utility and be able to protect you against a related strain. And that is the case with the SARS coronavirus 2. We know that the antibodies that you make in the original vaccination, for example, that first vaccine or second dose that you get, those antibodies will be useful against the new strains. Now, it's true that the match is not perfect. It's not 100% because the virus in the spike protein has mutated. What that means is that even though the antibodies are not perfectly matched to the new virus, the antibodies that you do make with the vaccination will protect against that new strain. Now, one of the things that we know, and I tell absolutely everyone that I talk to, is that we have no perfect vaccine. We have no vaccine that's going to prevent 100% of disease in everyone that is vaccinated. But that's okay, because one of the things we want to do is make sure that all of us have protection enough to prevent severe disease. And that's exactly what the vaccines do, even if you're faced with an infection with the new subvariants. And this is an extremely important concept because A, you want to avoid the emergency room. B, you want to avoid being hospitalized or have oxygen required for treatment. And you also want to avoid the ICU, which is a horrible experience. And we don't want anyone to die. One of the things I want to mention, Yvonne, too, is that one of the things CDC and all the groups that do modeling around the country are projecting, and this surprised me as well, is that into July, we are forecasting, believe it or not, 1,600 to 4,200 new deaths in the week ending July 2. Now, this is a projection. This is an estimate. That's why there's a range of 1,600 to 4,200 new deaths. But still, any number of deaths due to coronavirus or COVID-19 at this point now is really something to draw your attention to and realize that we can prevent the vast majority of these deaths with the vaccinations that we now have available. The other thing that's really amazing about the forecast coming up into July is that we're looking at new hospitalizations for COVID-19 in the range of 1,700 to 11,000. This number is staggering to me.
So these are new hospital cases?
Yeah, these are new hospital cases that are predicted to occur by early July. Now, the thing that worries me, Yvonne, is that we have an opportunity right now. It's June 10th, before the July 4th holiday, when we know everyone wants to have a barbecue, a picnic, go to the beach, have fun, get together, weddings, all kinds of events are going to occur around July 4th. We know this is going to happen. We know there will be people gathering because it's going to be hot and warm and people will be gathering everywhere in the water and elsewhere. That close proximity is going to be a great chance to transmit the virus. Your best protection right now, number one, the vaccine, for sure, without a doubt. If you've gotten the primary series, 1 or 2 doses, fantastic. Move on, get that booster dose for sure.
So now getting this booster dose, while you're right there, getting this booster dose. So there it was recommended that those who are 55 and older get the booster. But are you saying now that anyone, any age should get that booster? And then help us to understand, what about those who've already gotten the booster?
Right. So you are eligible if you've completed the primary series. And this includes really down into the childhood age range. And really keep in mind that we do have these vaccines approved for use in children down to age 5. And one of the things that's really important, I think, for people to know is that children need to be vaccinated too. This is extremely important. I know we have our Dr. W here, our pediatrician here. I hope she'll comment on this too. We want children to be vaccinated. It is safe, it's effective, and we really mean for them to be protected as well. The booster is good for anyone who's had that primary series. So that means 2 doses of Pfizer, or if you've had 2 doses of Moderna, or if you've had 1 dose of the J&J or Janssen vaccine. Those people are eligible for a booster. Now, one of the things we know is that many people are at high risk for more severe disease. There are special groups, the elderly, 65 and older, that includes older people. Anyone with an underlying medical condition, it could be diabetes, it could be heart disease, it could be end-stage renal disease, it could be liver disease, lung disease, anyone who's immunocompromised, meaning their immune system is not so strong. And this could be people that had an organ transplant and they're on immunosuppressive therapy, for sure, they need to be protected. Or if you're awaiting a transplant, and maybe we'll talk about this in just a second.
Yes.
Anyone who's awaiting a transplant, those folks should also be vaccinated. Very important, because once you do get the transplant, it means you're going to be vulnerable because you're going to be on the immunosuppressive medications that will tamp down the immune system, and you need to be protected.
So while you're right there, I'm sorry, you had one more point, because I want to get into this organ transplant, because that was a big question for a number of people, because they have family members who are on waiting list for a transplant, or, just thinking about what that means if you've already gotten a transplant.
Right, absolutely. One quick point before we move to that, I got to mention 2 things. One is we're now at a critical phase of the pandemic. A lot of people do the home testing. We know the virus is circulating still. We know that people can test at home and then watch to make sure that they recover at home if they test positive before they go out and potentially expose people to the virus. That's the first thing. So protecting yourself, number one, protecting others around you, also very important. And with that, Yvonne, I need to mention there is one new vaccine on the horizon. The FDA Advisory Committee is going to be reviewing data from Novavax in the next few weeks. It's going to be viewable online, so you can actually watch it. And the Novovax vaccine is a unique, novel approach. It's unlike the mRNA vaccines from Pfizer and Moderna. It's unlike the adenovirus vector vaccine from Janssen. It is a protein, recombinant protein, And it's a spike protein-based vaccine that has a novel M adjuvant that helps maintain a good immune response.
And Doctor, you're setting this up so well for our medical moment. Just
perfect.
right on. Yeah.
Okay. I mean, the vaccine, I think, Novovax vaccine has been performing well. The FDA is just waiting for a little bit more information because they want to make sure that the manufacturing facility is ready to go, set up, validated to make sure that they can make the vaccines once the vaccine is approved. And the FDA is looking at that literally right now. So
awesome.
Over to you. Thank you.
All right. So just let's talk a little bit more about this organ transplant, just to be clear that it is important for families to understand the vaccine, the virus, COVID, and organ transplant.
Absolutely. Absolutely. And, you know, we could do a future session on organ transplantation alone. But one of the things I wanted to mention to people is that there are thousands of people on the wait list, and there may be someone here on the wait list for an organ as we speak. The most commonly transplanted organ in the United States and in Michigan is kidney. That could be either from a related donor, a family member, or an unrelated donor or a cadaveric transplant from a deceased individual. There also are many liver transplants done. That's very common, rising as well in the United States. We have heart, lung, and other organs are transplanted. But the need is huge. And if you're not already on the donor list, you can sign up through the state of Michigan, and I can refer you to folks to help with that down the road. Maybe you can post on the Flint, Healthy Flint website. But the number of registrants for organ transplantation is growing. One of the things that we know is that everyone who is, for example, awaiting a kidney transplant or a liver transplant, the overall immune status of them is challenged. And one of the things that I really mean by that is that anyone with an underlying medical condition like end-stage kidney disease or end-stage liver disease needs to take particular care of themselves and be careful when they think about going out and being exposed potentially to COVID-19. What can they do? First, they can get the vaccine. Second, they can wear a mask when they go out. They're potentially going to be around other people in closed quarters, for example, in an indoor event or an indoor venue. That's the second thing. The third thing is to make sure that they talk with their doctor and optimize treatment for any other conditions that they have. For example, diabetes. If you have end-stage kidney disease, you still want to make sure that you maintain very good control of your blood sugars as much as possible. And of course, if you have hypertension and kidney disease or other diseases, make sure that you've really dialed in your anti-hypertensive therapy and talk with your doctor about what you can do to optimize and make sure that you're taking the right medication at the right dosage, at the right interval, and that your blood pressure is really well under control.
Thank you, Dr. Kier. Right at the right time, right medicine, right time, working with that primary care physician. I know that you're going to have to leave us in a little bit for another appointment, but we want to thank you today. And I just want to give you is there one other quick tip you want to leave? Because I think our roundtable really, our team, based upon some of the comments you've made, really resonated. And Nurse T is out talking about what you just talked about to patients in turn to our community about making sure that they understand the other chronic illnesses as it relates to COVID. And Dr. Reynolds has always been talking to us about making sure we follow those protocols. So before you have to leave us, I want to ask our roundtable to just jump in here right quick. And Katie mentions the mental health issues. So I know you've got some things that you want to share. So give us a couple of those things. Dr. Reynolds, I see you.
I'm glad you're talking about whole organ transplants, and I'm also glad to see Dr. Kilgore, who has helped us for at least the last 7 years, and that doesn't include all the people he helped train. But I want to share with you, in my extended family, a wife donated her kidney to her husband just 48 hours ago. And having people properly vaccinated, masked, and following protocols, and probably staying away from their home even when they get home, those are most important things. You never know when the decisions you have not made or unwise decisions you have made will affect someone around you. And that's what makes this so important, including getting your influenza shots, but that'll come up, I'm sure, again in August.
Nurse T, I see you and Dr. Tressa there. You're out in the world, making it in the streets, making it happen.
Yes, we are.
Can you hear us?
Yes, now we can. Yes.
Okay.
So I just have one question. I just want to clarify as far as the age. I thought the age 50 or 55? Because according to some literature that I read, CDC was saying that it was 50 and over for the booster, and if they were immunocompromised.
The fourth booster
Yeah.
is 50.
Is that for that fourth shot you're talking about, Nurse T?
Yes. Yes.
There, what I can do is put a link to some information about the booster dose. I can do that in the chat if that's okay, and then send it out. I think one of the things that people should know is that right now, when we talk about the fourth booster dose, it's really designed for people that may have not had a really strong immune response, or they might be older. And I'll make sure that I put in all the specifics on the age group, but essentially it's really those who may be immunocompromised. They could be young, but immunocompromised, and especially those that are 50 and older, they should receive the second booster dose at least 4 months after their first booster.
Right. So Dr. Kilgore, these ladies are out there right now. They've just done a session earlier with our seniors. So this information is so incredibly important to us. And I just, Katie, just real quickly, I know we're talking about organ transplants and some of the things that if you've got a tip from the mental health perspective, and then we're going to hear a final comment from Dr. Kilgore.
Yes, I would just like to say how important it is. Thank you so much, Dr. Kilgore and Nurse T, for sharing this information, because education is so powerful. It's all part of our self-care for our physical, mental, and our spiritual well-being, that we know accurate information. We hear a lot of things from family and friends on social media and different kinds of things, and they might not be the best resources all the time. So thank you so much for sharing and getting these the correct information out to people, because again, it's all part of our mind, body, and spirit are all connected, and it's part of our total self-care. So thank you.
Thank you. Now, Dr. Kilgore, already we've got a request that you come back. So we're going to get that date because we even want to know more about the things that you're sharing with us today, particularly as it relates to the variants and what things we can do. And as we said, more on this organ transplant, because that's critically important. So I'm going to give you the last word in this segment, Dr. Kilgore.
Absolutely. Thank you very much, Yvonne. Thank you, everyone, and great questions. I'm putting one more bit of information in the chat for everyone. They are potential sources of the N95. So there was a question about I'll be traveling and where can I get the N95 mask? So there are free sources. I'm sure there's someone else on the meeting today who also knows of a source. But there are some local pharmacies. For example, there's several Rite Aids in the Flint area. There's a Meijer on Hill Road that may also have them. Kroger pharmacies have been making masks available, Walmart and Walgreens as well. So you might want to just call your local pharmacy and see if they can have them, and then you don't have to travel too far to get it. That's my comment. Thank you.
Thank you so much, Dr. Kilgore. And we will look forward to having you back. Of course, every time you share, there's great information, and there's more to come because you're continuing to study this. There's new information every day. We're hearing something new, and it's important for us to get the credible information that we can trust from a trusted resource. So thank you so much.
Thank you, and see you all soon. Thank you.
All right, take care. He set the segue. He's talking about this vaccine that's coming up, and our own Dr. Susan Wolford has done a lot of research and has got great information for us today. So for those of you, again, if you've got questions, please put them in the Q&A. And if you have someone that you want to make sure they have an opportunity, you want to have them dial in right now, get on the webinar right now. Dr. Wolford is going to give us some very important information about this new vaccine. Dr. Wolford.
Hi, Yvonne.
Hey,
I
you're
feel like
sideways, Dr. Whip.
my camera is sideways. I'm not even sure how to stop it from being sideways. Maybe we'll just stop it for a moment and try to see if I can get it to release itself, and it won't. Let me see if I can get to share my slides. Let's start with that. So we can go there. Okay. Can you see my slides?
Yes.
Yes. Okay, great. I'm going to have to try to work out how to be right ways up because I really do actually want to show you something and be spotlighted afterwards. But we're going to talk about the Novavax vaccine, as Dr. Kilgore gave us the great segue into. So there are a few points I'd like to make about it and then discuss how it works. So because we've had a lot of concern about newish vaccines, and so here's one that isn't as new in the way in which the vaccine was created. And so hopefully this is something that those who have concerns about other kinds might be willing to get the Novavax vaccine. So it's about 90% effective against the original COVID-19 virus. And so that's very comparable to the other vaccines that are out there and already in use. It requires 2 shots, much like the mRNA vaccines, and we do those shots 3 weeks apart. It can be stored in regular refrigerators, so it doesn't have to be kept super cold, and so we don't have that problem. And as I said, it uses a technology that has been used for vaccines for decades. And so it's been used in some flu vaccines, for hepatitis B vaccine, for the whooping cough vaccine, and others as well. So a little bit about how this works. What they did is they took a virus, but a virus that doesn't infect humans, but one that it typically attacks insects. And they put in it the part of the genetic material that is needed to make the spike protein. They then infected cells from moths. So they took cells from moths, let that virus go in and infect that cell, deliver the genetic material with the instructions for how to make the spike protein, and that way the cells then made a lot of spike protein. So now they had a ton of spike protein being produced, and they used what's called a nanoparticle, a small particle, and they attach the spike proteins to it so that it can mimic a virus. But there is no virus there, right? It's just the spike protein on this nanoparticle. And that is what is put into the vaccine that is then delivered to us. So Dr. Kilgore made a comment, and in fact, he started to make a comment about what else is in the vaccine. There is one other thing in the vaccine. Let's see. Oh, we're going around and around.
There you are.
Oh, now we are the right way. If only I can stay that way. Okay. So he made a comment about what else is in the vaccine. And I think this is a really important point, but it's really tricky to make. So Yvonne, I want you to make sure, if I've muddied the water anyway, please ask me questions about this. So when that nanoparticle with the proteins on it, with the spike protein, is put into our body, we know what it wants to do, right? It wants to teach our body how to fight the spike protein. But just the spike protein on that nanoparticle, on that small particle, isn't really enough to make our immune response strong enough. So they have to put in something else to kind of attract those immune cells to come and fight it and learn how to recognize that spike protein. So that other thing they put in is called an adjuvant, or like an additive, or something to activate the immune system. That other thing, I believe that you're going to hear people say, oh, they put detergent in your body, so therefore you don't want the vaccine. It's got detergent in it. And like most other misinformation, there is some small truth to it, and then a whole lot of not truth to it. So just like, for example, one might use lemon juice as a cleaner, right? I can put this in my food and I can use it as a cleaner. It is not the same as my shower cleaner, right? My shower cleaner, I'm not going to put in my food. Both of them can be used as cleaners, but one I can eat. I think there's an advert, the eats and the not eats. Can go in the body and this can't go in the body. So while they both do the same job of cleaning. So the idea that they put a detergent in is true. It is the same chemical makeup, but it's a very natural one that all it does is it makes some of our red blood cells break apart. And by doing that, it activates the immune system to come in and learn how to fight that spike protein. So it's in the amount that makes sense. It's a natural component that and it works well without problems. And it gives us another vaccine that can be used if people would prefer this form of vaccine, a form of vaccine that's been used for many years versus the mRNA vaccines, which are newer.
Yeah. So the distinction is one is using a derivative of what might be a normal, the RNA, DNA kind of RNA. And this is not using that at all. It's using a totally separate process that we've historically been used to develop vaccines.
Exactly. So if you remember the previous ones, for example, the mRNA, we said it was like a fat drop, like my Hershey's Kiss here, with the little paper in there with the instructions for making the spike protein. That was the mRNA ones. We know that for the J&J, it took the genetic material, like the seed, it took part of it, the part that creates the that creates the spike protein, and put it into a different virus, not the coronavirus, put it into a different virus and use that to deliver it into our body. And now this one says, okay, no making the spike protein in the body at all. We will make it out of the body and just deliver that spike protein to you.
Okay, so now you make me want to take a science class with you teaching it. but thank you, Dr. Wolford. These are really challenging concepts, for us who are not in the medical field. They're challenging. But what we want to do, as Dr. Kilgore said, and even as Dr. Reynolds said, we want to get good information so we can make an informed decision. And we call it sometimes wise choices. That's our little tagline for our project initiative. But it's really helping us all get good information and make wise choices or informed decisions. And that means we have to continue to ask these questions. So we'll be asking you more questions, Dr. Wolford, as we go on and get a better understanding. But we do appreciate you for sharing that with us today. And of course, we're going to be talking about, now I see the Hershey's Kiss again and the chocolate candy going into the orange. And now we've got this moth that we're going to be thinking about. So thank you for sharing that with us today. And we look forward to hearing more from you in the days and weeks to come. So Dr. Allen, we're going to go to our getting some data now that we have gotten this science lesson and understand that there are different versions. We want to really understand what's happening in our community as it relates to the current state of affairs in our community. So Dr. Allen Harris, who's been working behind the scenes at Michigan State with our data team, help us to understand where we are right now with the data, particularly as it relates to confirmed cases and the race data.
For sure, yeah. Thanks for having me. By the way, not a doctor, just a mister. But thank you for the upgrade, I guess. Yeah, so we're looking at Genesee County and Flint numbers from this past week. There was a slight increase of confirmed cases. So those are ones that we don't count from the probable cases or our lag cases, which are like someone became infected, but the results of it came in later. So then we're sort of retro adding those numbers to their appropriate weeks. So there's just a very slight increase in confirmed cases in both Genesee County and Flint. But once you add in lag and probable cases, we're still seeing a steady decline. And that's what's happening in our region, and that's what's happening in the state in general. But as we move forward, as we sort of put a health equity lens on it, we do want to continue to monitor any racial gaps that are happening between African American cases and white cases. We saw some spikes, and we don't know if it's a trend or not, because if it's just a spike one week and then it's not there the next, then it's it's just how the spread is behaving. But we usually take, if we have a wave of, say, 10 weeks of data, we're always monitoring that racial gap of what percentage of African American were infected versus the white population. And so we'll continue to monitor that. One thing that comes to mind when I see these numbers and I see the date is that 2 weeks ago, or this weekend, 2 weeks ago was Memorial Day weekend. So we may see either a slight increase again or just a slower decline, I think.
Mhm.
As far as what's happening throughout the country, as the Midwest, Michigan, that area is starting to see a decline, a slow decline. Hotspots are emerging in the West and Southwest. So that's happening, as well as our testing positivity rate is slightly going down, as well as the cases.
Thank you so much, Alan. And we appreciate you stepping in. Dr. Rick Sadler has usually been here with us, but we thank you because you're working so closely with him. And you also help with developing the dashboard with the health department and continue to do that work. And so we're going to segue into the conversation with the health department. Ashley is here again with us today. She's the emergency preparedness coordinator. And so Ashley, we welcome you again today. And as we look at the dashboard from what's going on, and I know we can go on the health department website and look at this, but I thank you for giving us some context and putting a little bit more clarity on what these numbers are saying. So help us out, Ashley.
Absolutely. I'm always here and happy to help. So as of right now, as our dashboard is presenting on our website, we are at 107,140 total COVID-19 cases. Since Genesee County has reported its first case with a total of 1,766 deaths, we make this information readily available just so that you can see the proportions between, age data, cases in respect to gender and race and whatnot. So this is able to give people a more in-depth look on how COVID is spreading throughout our community based on those factors. At this time, we have 11 ongoing outbreaks across different organizations, either schools or skilled nursing facilities. Those are all watched very closely by our epidemiologists here at the health department, just to make sure that they not only have protocols and plans in place for infection control, and as well as for proper cleaning, and if they
It looks like we lost Ashley.
It does. Okay. I wasn't sure if it was me, Heatherlyn, or because so we want to just kind of keep moving along here. So we'll wait just a few minutes, but let me just ask, I want to ask Dr. Reynolds if he could step in. Oh, there you are, Ashley.
Yeah, my computer crashed. I'm on my phone, so my apologies for the background. I just jumped right back on. So if you see Sea Life, that's just my background. So at this time, what I was saying is we have 11 current outbreaks. Our COVID vaccination dashboard has not updated. The gentleman that does update it has been out of the office. but we are keeping track of that on our own just to make sure that those numbers stay consistent. So when updates are done, we can see how we got to that point.
So
of right
Ashley,
now,
can I just, I'm sorry, just tell us, help us to clarify. When you say outbreak, what do you mean specifically?
outbreak. So it's going to be dependent on the organization that is reporting the positive. So in this case, for let's say a skilled nursing facility or a long-term care facility, if they have one or more COVID-19 cases listed within that facility, we consider that an outbreak.
Okay.
Same goes for our correctional facilities as well. We try to keep ahead of any positives reported to us so that we can keep control of any kind of transmission within that close enclosed group.
Thank you.
Yeah, absolutely. And like I said, it's across a number of different types of organizations. So when I say there's 11 active outbreaks, we need to keep in mind that these are long-term care facilities, schools, elementary, high school, college, as well as after-school activities, including prom. It is prom season, or was prom season. So these are things that we are being mindful of. Moving forward, we are mindful of the fact that it's graduation season as well. So we are going to be looking for any kind of reports of positives in line with, let's say, open houses or any kind of festivities that come with graduation. So for COVID-19 vaccination rates, at this time, we're on day 513 of vaccination efforts. So far, we have 834 vaccine clinics under our belt. We have hosted 834. We are well over 90,000 doses, I believe, that we have given. Like I said, we keep track of that on our end until Ken can get back and update our dashboard for us. Our vaccination rates within the hospitals, we have 35 inpatient right now reported across all 3 hospitals. No pediatric COVID patients have been admitted at this time. We have 49 total admissions for the month of June. Of that, 47% of them have been reported as fully vaccinated, leaving 53% of them reporting either unvaccinated, partially vaccinated, or unknown.
Mm-hmm.
So,
and these, for the persons that are partially vaccinated or unvaccinated, one of the concerns is that they may be sicker. So we want to make sure, that's why they're looking at hospital rates, want to make sure that that vaccination helps protect. And that's Dr. Reynolds' thing. It helps protect. It isn't the only protection, but it's one of those layers of protection. And so, Ashley, while we're here, we just want to review real quickly. We know we have our sites open. Any special clinics coming up this week?
There is going to be a clinic tomorrow on the 11th. My screen's much smaller now, so I'm going to, at the Pearson Road YMCA, that's a pop-up clinic from 11 a.m. to 2 p.m. that is ages 12 and up. And then apart from our usual rotating 3 faith-based sites, we have another pop-up clinic at Hasselbring Senior Center next Friday, the 17th, 4 p.m. to 6 p.m. And that is also 12 and up.
Thank you. So we've got those regular sites that are available, and then our testing sites are still in action.
Yep.
Not doing, as you mentioned to us, not doing the COVID vaccines anymore, but they are still doing the testing.
You are correct. Our HANU sites no longer vaccinate, but are still moving forward with testing efforts.
And of course, if people need some extra support, they can call you where?
They can call. So if they need support in finding resources in any way, shape, or form, they can call us at 1-810-344-4800. If you do have access to the internet and are internet savvy, we recommend you start at gchd.us. We have numerous links and resources on there to help you get you to where you need to be. If you're still having difficulty, always give us a call.
Thank you, Ashley. We appreciate you coming on and giving us those insights, because often we don't really get what's happening in the hospital. So we appreciate you sharing that with us. And we just want everybody to know you can hear. And again, this might be a quick jump in for Dr. Reynolds. I'm pulling on him today in this segment as well, because there are people who have gotten vaccinated that are still getting ill, as mentioned by Dr. Kilgore, these subvariants, but also those who are not vaccinated. And so we want to do what we can to protect them. Dr. Reynolds, while we're right here, your key line, vaccination is what?
Vaccination is the foundation for the prevention of complications from COVID. Those complications can be getting severely ill, hospitalized, put on an event, and even worse, dying. But then there's also the possibility of long COVID, and we're learning more and more about that. And when I get something that I can say is rock solid, I can say more about that.
Thank you, Dr. Reynolds. And one more quick question for you, Ashley, as we look at this. Can you just give us another quick insight on why it's important, even when people test at home, if they test positive, to report to the health department, and how will they do that?
We recommend if you have a self-test at home and you do test positive, we do have the opportunity for you to report your positive on our website at gchd.us. It's going to be a central link right smack dab in the middle, so that you can report your positive test. Now, the state of Michigan does not require you to report your positive test. Now, because it's not required, we're not able to release that data just because it's not standardized. At the same time, we can't promote any certainty on whether or not people are reporting their positive tests, again, because they're not required to do so. We do ask that you do share that positive notification with us, just in case you should need any resources or assistance from our end in any way, shape, or form. I've had people call me for a very large spectrum of things, including being able to pick up their prescription medications because they can't leave the house because they're so ill, or how they go about getting transportation for their loved ones for school. And, it's just a large spectrum of things. So if you're at home and you test positive, report your positive to us, call us if you have questions or concerns, and we can definitely try to point you in the right direction to make sure that you come through this both feet on the ground as healthy as possible.
Thank you, Ashley. It's so important to know our health department is here, ready and able to assist us in any way that there is a need, and that you're able to do so. So thank you for sharing with us today, Ashley.
Thank you.
As we look at what the health department is doing from a county perspective, our city is busy. And so we have our communications director for the city of Flint, Kiana Towns-Williams, is here with us today to give us some updates from the city. And Kiana, there is a whole lot going on in the city, and all of these relate to our overall health and well-being as a city. So give us these insights, please, for today.
Yes, there is indeed. Thank you. Good afternoon, everybody. I want to start with an event that's happening tomorrow. I've mentioned a couple of times on the webinar that the event is coming up and it is finally here. So for those of you who have tires in your garage or somewhere in your community, tomorrow is drop-off day between 9 a.m. and 1 p.m. At Environmental Rubber Recycling. So please let your neighbors know. Thank you to everyone who shared the information. The community is getting prepared to get these tires collected and improve the environment. Also coming up next Sunday, or this Sunday, 2 days from now, is the Flint Flat Lot Day Fest. Try to say that 5 times fast. There will be food trucks available, live music. It is a family event. And I do recognize that there are some people who have reservations about visiting downtown at the Flat Lot due to some past events, but want to encourage families to come out between 2 and 6. It is our city, and we have a wonderful event planned for families. So please come out and participate. On June 18th, the city of Flint will celebrate Juneteenth with a parade and also with a concert, and I'm really excited for this one. I have my tickets. Just at the top of the Rutherford parking ramp, we are going to get a live and in-person performance from the city's own Mama Soul. And we'll also have a fireworks display. So we would encourage our residents to bring your lawn chairs, get set up for a night of events in celebration of freedom and in our Juneteenth celebration. So if you are still looking to get tickets, you can visit flintjuneteenth.com, or you can call 810-210-5045. The Doing Business in the City of Flint event is coming up at the Flint Development Center on June 21st. That's from 9 a.m. to 12 p.m. for anyone who is interested in learning more about how to get their businesses started. You are invited. That's everybody from the community to those who already have established businesses and are looking to expand what they are doing. So if you have an idea for a business, you want to learn more about how to get that business going here in Flint, you certainly can go ahead and register. The address is right there. And you might also contact Tyler Bailey, who is the small business specialist here at the City of Flint at tbailey@cityofflint.com. Ooh, we're still going. This coming July, the Flint Fire Department will host a summer youth camp for kids. I believe it starts at age 15, though some younger applicants may be allowed to participate. If you have a kid who's interested in firefighting and learning the skills that are outlined here, including communication, critical thinking, collaboration, and leadership, I would encourage you to sign your child up for this youth summer camp. The information to do so is online at thecityofflint.com. You might also contact Deputy Chief Edwards Clemens at cedwardclemens@cityofflint.com, or you can call 810-762-7336 for more information. And that's 12 to 17, but younger kids might also be considered. And then great news for the City of Flint. Blue Trident, which is the parent organization of Ice Mountain, has made the organization in collaboration with the City of Flint made the announcement on Monday that they would continue water donations to the City of Flint through December 2022. In addition, the organization donated $60,000 to the United Way to support transportation of that water so that the help centers did not have to pay for the water to get to each of the help centers. So that water will continue to, bottled water will continue to be donated and delivered to Flint residents through the end of this year, and is made available at each of the help centers noted here. So those distributions generally start about 10 a.m. Folks do line up a little earlier than that, and they wrap up when the supplies have been given out to the community.
So Kiana, while we're right here on this is really important because, you know, it's been like, what, 7 years now, if I'm counting, since the water switch. And we are still utilizing the bottled water. But these sites, what we call our help centers, have been set up at these churches from the very early stages of the water crisis, providing not only water, but lead mitigating foods. And they're still doing this work after all these years. And so I know from having just traveled, and the lines are still very long. There's still a great need in our community. So it's wonderful to see that this is still going on. So if you know of anyone that needs assistance from these resources, please utilize them, because they're also giving out information about other things and resources that are available in our community.
Yes.
So Kiana, coming up this week is also a Water Systems Advisory Council meeting on the 13th. Wonder if you could, as part of your role, if we could just have a quick conversation about the importance of the Water Systems Advisory Committee and Council, and the city's role in helping keep this information available to our community.
Yes, so the Water System Advisory Council is an opportunity for a community to engage in and be in conversation with the administration about their concerns or any other subject matter related to Flint water. So attendance at the meeting is always beneficial, as it gives the community the opportunity to engage with the Water System Advisory Council, which you are a part of, and share out information that is relevant to our community. It's a great way for us to stay connected to the community and really hear about what the concerns are. And so we encourage residents to come out on Tuesday at 5:30. This meeting is going to be in the Harris Room at the newly renovated Flint Public Library. So we are excited about being in that space and encourage our residents residents to come out and participate, because your voice and your ideas around how we might be able to address concerns, they do matter. So please come out and share that with us.
Thank you so much, Kiana. And as we close our webinar out today, we say to you every week, for those of you that are social workers and community health workers, stay on a little bit longer and apply for those continuing education units and the social work credits. There are processes in place that will help you to make sure that you get those credits. So please stay tuned for that. And as we say every week, we thank you for tuning in, and we want you to continue to join us on Facebook and subscribe to our YouTube channel, Healthy Flint. Email us with questions that you might have at info@hfrcc.org, or please call us at 810-835-2130. And by request and because of your wonderful participation, we'll be back here next week for session 118 for the Flint Community Webinar on coronavirus. Thank you so much for joining us today, and we'll look forward to seeing you next week. Okay. Thank you, everyone.